I'm getting it too. Okay. So hello, my name is Mary Yellick. I'll be talking this afternoon on Bell's palsy. Bell's palsy is a disorder which you may be seeing in primary care in your office. So we're going to start with this diagram here, which would be a typical frontal look of someone with a smooth forehead, inability to close their eye completely, and drooping of their mouth caused by a problem in the facial nerve. So with a sudden weakness in the facial nerve, it makes half of the face start to droop. The cause is still unknown, but it's believed to be a result of swelling and inflammation of the facial nerve that comes on one side of the face. It occurs in about 1 to 4 out of 10,000 people per year, usually between the ages of 15 to 60. I was a little surprised to see the 15, because most of the patients I've seen probably have been in their 40s to 60s, I guess. It's temporary in most cases. They usually start to improve within a few weeks. To complete recovery within 6 months is our hope. Sometimes they are impaired for life, but rarely does it reoccur. So this photograph on the PowerPoint is a patient with right-sided palsy. Obviously, the one side photograph is when she was really affected, and then the other one is when she started to improve, okay? Viruses of Bell's palsy are believed to be caused by multiple viruses that are listed there. The most common that I've come across probably are EBV, the herpes zoster, and herpes simplex viruses, although the others are a consideration. The nerve that controls the facial muscles goes through a bone in the narrow corridor of the bone on your face. It becomes inflamed, it gets swollen, and thought to be related to this viral infection. Beside the facial muscle, the nerve that affects tears, saliva, taste, and a small bone in the middle of the ear get affected. So this diagram or figure is of facial nerve anatomy and facial nerve innervation. So as you can see there, the facial nerve, and you can see just a shadow of that bone. Of the nerve, it's yellow on the diagram, and then those are the branches. And those nerves, branches are what get affected and affect that side of the face and cause the weakness and symptoms that you see. So what do we get concerned about? We get concerned that the facial lesion could be supranuclear, which means within the contents of the brain itself. And the other one is usually what we see as a lesion in the facial nerve itself from some sort of virus. So the signs and symptoms come on suddenly, and they can include this rapid, mild weakness to total paralysis, hours to days. So, we think about the stroke victim, and we think about that concern. It makes it difficult for the patient to smile, close their eyes, they droop, the facial expressions are affected, they have pain in the jaw or behind the ear, which could tip you off on the affected side that it's Bell's palsy. They'll have increased sensitivity to the affected side. They could get a headache. They could have their ability to taste be affected and changes in their tears and saliva. So this is the signs and symptoms that patients will see. The inability to wrinkle their brow, they droop again their eyelids, they can't close it, they can't puff out their cheeks, they don't have that muscle tone in their face, they can't smile, they can't pucker. In rare cases, it goes to both sides. I have not had the experience of seeing that, but it has been reported. So what tests and how do we diagnose Bell's palsy? There really is no specific blood test or diagnostic test. The clinical exam would show the face, looking at the face of the patient, testing facial muscles, closing eyes, lifting eyebrows, showing their teeth, frowning, and other movements. So when would someone come into the doctor? And like what the previous slide showed, this can occur within hours and build up over days. Some people might just notice it, and then they're like, oh, I wonder what's going on, and then it progresses, like I showed you in the diagram, um, previous. Bell's palsy is not caused by a stroke, and we talked a few minutes ago about sometimes people, present to the ER with this diagnosis, and then we have to get that that's in the differential, but it gets ruled out. But if you do have this, if a patient would have facial weakness or drooping, they should be seen to find out the underlying cause. So what conditions can cause, other conditions can cause facial weakness and mimic Bell's palsy? Lyme's disease, tumors, like we showed on the one side, supranuclear tumors in the brain can affect the facial nerve. So you have to keep that in the differential as well. There are specific tests that could show us the supranuclear lesion, and that would be that MRI of the brain, which would probably be the one that most providers would be ordering. So what you're looking for inside the intracranial, in the cranium, is a tumor or skull fracture and anything that could possibly be causing pressure on the facial nerve. The EMG is a test that confirms the presence of nerve damage and determines its severity. So an EMG is a test that has voltage, measures how long and how much, when the nerve is stimulated, does it react, if you will. So the specialists in this area can tell us if that nerve lesion is affecting the facial nerve outside of the brain. So what are complications that cause recovery from a case involving total paralysis? Most people with treatment do improve in a month. But however, there are people with irreversible damage. There are others that have, when the nerves do regenerate, they don't really result in not completely healing, and then they end up with certain muscles causing constriction when they smile, or their eye closure is not as complete. Now, in certain cases, they have partial or complete blindness of that eye, and they get dryness and scratching. So that, we could cover at a later time, but just be aware that can happen. So what meds would you want to consider? So a patient comes into the office, your differential is Bell's palsy versus stroke versus what other things it could be. And if you have some expertise in this area and you've seen it before, I think there's some providers that have seen several cases, so they're very astute and they know the difference. Corticosteroids, from my reading even recently, seems to be the drug of choice, even above and beyond the antivirals like acyclovir. So it helps to reduce that swelling, and it helps to make that nerve fit better through that bony corridor I showed you on the previous diagram. And the literature and the readings that I did, best if you get that treatment started within 3 days of the symptoms occurring and benefit with 14% greater probability of recovery. So in one instance, I had a lady, she didn't really get to help on time, if you will. So she was the one that had the facial contracture a little bit still, and then not the full eye closure, even this has been 15 years afterward. So she was one of those people that was left with the residual, if you will, scarring or damage to her facial nerve that never fully recovered. So that's why getting the steroids on board is very important. Now, acyclovir, or the antiviral drug valacyclovir or Valtrex, it stops the progression of the infection. If we talked about the suspected viruses, this treatment is only offered in conjunction with the corticosteroid if the facial paralysis is severe. On my reading, they didn't seem to like that, to think it was worked that all well, but I think in conjunction, you probably have nothing to lose, but make sure the steroids get started. Now, physical therapy. The literature does state physical therapy, especially for people who've had, that month to 3 months to 6 months of the shrinking and shortening of those facial muscles. They did say the massage and exercise to facial muscles can help and prevent and improve the facial problems that occur with Bell's palsy. surgery, even in rare cases, I think it was more of a go-to years ago. It is not really used as much except in severe cases where they have lasting facial and nerve problems. And that's mostly in people who couldn't smile anymore or the complete eye closure in the literature that I read. So that's the end of the discussion on Bell's palsy today. Thank you.